Hello, you're watching Eye on Africa. I'm James Creedon. These are our headlines from across the continent this evening. More and more cases of coronavirus have been detected across Africa. We'll get a roundup of how different countries are responding to the pandemic. And in South Africa, over 60 cases have now been diagnosed. We'll talk to our correspondent in Cape Town about the impact of the virus there. Now, it's a global concern and a growing one in Africa. The coronavirus has now been confirmed in at least 30 of the continent's 54 countries. So far, Africa has been less affected than China or Europe. Experts have given varying explanations as to why. Nicolas Germain has more.
Little by little, the coronavirus is spreading across Africa. Cases have now been found in 30 of the continent's 54 countries. Among them is Liberia, where a deadly Ebola outbreak killed nearly 5,000 people between 2014 and 2016. President George Weah announced specific measures against Covid-19.
All travels from all countries with over 200 or more coronavirus cases are hereby banned.
In South Africa, more than 60 people have tested positive, and the government said it was worried about a particular category of the population.
We are concerned about particularly the communities, particularly the poor, the working class in the townships, in the informal settlements, in the rural areas where resources are scarce, where a lot of services also do get challenged.
But so far, Africa has far fewer cases than China and Europe. One reason is that since the outbreak of Ebola, many countries have set up early screening systems at airports. Some analysts also point out that better-known coronaviruses than Covid-19 are less prevalent where temperatures are higher. But that hasn't prevented some countries like Thailand of being hit. Lastly, Africa has the world's youngest population, and so far the virus has mostly killed elderly people. Health experts are concerned, though, that with the world focusing on Covid-19, researchers will neglect the infections that kill hundreds of thousands of Africans each year, like malaria, HIV and tuberculosis.
Now, as we saw in that report, there is concern in many countries about the capacity to respond to a coronavirus epidemic. We can cross now to Cape Town, where Jane Flanagan has been following events for France 24. Jane, we're hearing about 60 plus cases so far and probably the strongest response of any African state. Give us the details on those very ambitious announcements.
Well, Cyril Ramaphosa, the president, was very firm, and last night in an address to the nation, he announced a state of disaster for the country. He ordered schools and universities to close. He banned large gatherings and imposed really very strict travel bans in and out of the country to affected areas such as Europe, United States and China, really key allies of the country, and revoked any visas issued to hard-hit countries in Europe and North America and Asia since the start of the year. So he went in very firm and very hard in an effort to really stem a sharp rise.
But Jane, as mentioned by the Health Minister, South African Health Minister, we saw him there in the report, he spoke about informal settlements, townships. I mean, this is an infrastructure that is under-equipped probably to respond to the virus if it were to start to spread through informal settlements, right?
Absolutely. How is it that people can self-isolate when families are living in such close proximity? Large numbers of people are sharing maybe 1, 2 or 3 rooms, and neighbours are very, very close together. It is going to be very difficult for people to keep other people safe and keep their distance if this infection spreads. And I think that is why the president announced such tough measures straight away. But against the backdrop of this, of course, South Africa is also entering its second recession in as many years. And with these really firm travel bans, it's going to place even greater strain on the economy and maybe even on lead to the loss of more jobs. So he really has got a delicate balancing act, and South Africa has got some challenging months ahead.
Indeed, like many parts of the world. Thank you for that, Jane Flanagan from Cape Town. Now, how is the World Health Organization preparing for this emergency across the continent? We can talk now to Dr Michel Yao, Programme Manager for Emergencies for the WHO in their Brazzaville office. Thank you, Dr Yao, for talking to us on France 24. Tell us about the preparations of the WHO, which, let's face it, has a nearly impossible task on its hands in terms of optimal support across the continent.
Thank you very much. For WHO, our support is actually in the main response areas and also related to the gap that we highlight when we were doing the readiness assessment. And one of the major gaps is actually treatment and treatment facilities. And as we can notice in Europe, it's one of the critical areas if we want to reduce death toll from this virus. So it's to ensure that treatment capacities are kind of prepositioned and prepared to deal with the worst case scenario. Should there be any community wide transmission? And this is actually our main concern, urging countries to work in this area. The other part is right now in many of the African countries, we're still in a containment phase. So to ensure that at least we can prevent the virus from moving to a wide community in mainly the slum, where we can have a major challenge dealing with a huge number of cases. And this can actually affect also access to health services for other conditions, mainly for women delivering and also to treat malaria in some of the hospitals. So it can have a kind of collateral impact in terms of death toll, not directly related to this one. I know that there is also a myth that also the African population is young, but we have also other factors. That is, for example, malnutrition and also some of the HIV head prevalence in some of the countries, it can be high, and all this could be a kind of a risk factor for this virus. It's quite new to assess this impact because it's a new virus, but all these need to be taken into account, and we appeal actually for solidarity despite the fact that the virus is also affecting many of the donor countries.
Now, we've heard about a number of countries suspending flights. Algeria has suspended travel to Europe. Morocco, international flights. Liberia imposed a ban on all countries with more than 200 coronavirus cases. Should we be seeing more of that? We've seen Europe. It took a while for the measures that we saw initially to be implemented elsewhere. Should Africa act now, basically, to contain the spread of the virus?
I think learning from what is happening in Europe is for sure we need to act now, but we need to act based on evidence. We need to ensure that all the decisions are evidence motivated. And one of the things that could actually affect Africa with all this travel back, we will be stuck in terms of supply chain. Most of the reagents are coming from outside of Africa, as well as what is required in terms of supply to treat people. So I hope this different travel ban will not affect also the supply chain and also movement of aspect. It's a new disease. Many people still need to be capacitated to appropriately manage this crisis. So this is actually our concern, while also understanding that people should take appropriate measures, but this should be taken based on the assessment of the situation. We're still in the containment mode in most of the countries.
OK, Dr Michel Yao, thank you for those insights from Brazzaville about the efforts underway by the WHO across Africa to contain the coronavirus spread. Now to Nigeria next, where a gas explosion has killed at least 17 people in Lagos. The blast took place early on Sunday next to an oil pipeline and destroyed around 50 buildings in the residential district of Abule Ado. The state-owned oil company NNPC has said a truck likely caused the accident when it hit gas bottles in a processing plant. To the DR Congo now, where former warlord Thomas Lubanga was released from prison on Sunday. Arrested in 2005, he was the first man to ever be convicted by the International Criminal Court. He was found guilty of war crimes in 2012 and sentenced to 14 years in jail for recruiting and using child soldiers in his rebel army in the early 2000s. Our correspondent Clément Bonnereau has the details.
Thomas Lubanga was transferred to Kinshasa from The Hague in December 2015 to serve the end of his sentence. He's now a free man after spending 14 years behind bars, but he's so far refused to speak to international media, saying he needs several days to readjust to daily life. His lawyer, whom we contacted this Monday, continues to say that his client was innocent and that he served as a, quote, guinea pig at the International Criminal Court. Lubanga was found guilty of war crimes in 2012 for recruiting and using child soldiers during the Second Congo War in the early 2000s. Victims, meanwhile, are still waiting for reparations. In 2017, judges awarded $10 million in collective damages to some 425 victims, mostly former child soldiers. But so far, only about half of that sum has been collected, and it is yet to be invested in projects aimed at helping victims rebuild their lives and reintegrate back into society. The ICC representative in Kinshasa, however, insisted that the Independent Trust Fund for Victims remains, I quote, committed to raising those funds.
France 24's Clément Bonnereau there in Kinshasa. Thank you for watching. More news coming up.